Hey, Black Oakland.
Hey, Black Oakland.
Hey, Black Oakland.
Hey, Black Oakland.
Salutations and blessings, Black Oakland.
Hey, Black Oakland.
Hey, Black Oakland.
Hey, Black Oakland.
We gotta talk. Some of us learned about the coronavirus through social media, and we thought it was just another joke, the Rona. But we now know it's not a joke. It is real, and it is really killing the Black community at higher rates than any other population.
We're getting this at higher rates because African Americans have higher rates of high blood pressure, diabetes, heart disease, lung disease, such as asthma and chronic bronchitis, and autoimmune diseases like lupus. These pre-existing conditions make us more susceptible to COVID-19.
Why? Because racism is a pre-existing condition. Poor health in Black communities are linked to this nation's history of racism. This did not happen randomly or overnight. It's the result of policy choices like segregation, substandard housing, food deserts, low-wage jobs, poverty, and threats from environmental racism that have created systemic inequalities in this country. As a result, our community has been plagued by chronic health conditions that put many of us at special risk during this pandemic.
We are also getting it at a higher rate because many of us are essential workers. We have to choose between earning money to eat or catching the coronavirus.
Unfortunately, our federal government has failed to provide adequate leadership. Instead of clearly communicating the information that will make all of us safe, too often they have sent us mixed messages and confusing information. So we wanted to make sure that everyone had access to the facts about this disease and how we can help to keep ourselves safe. Taiwo, who's affected by this disease?
I'm so glad you asked that question. Anyone can get COVID-19, but for some people it is especially dangerous. For example, people of all ages who have pre-existing conditions like asthma and diabetes are very much at risk. Additionally, the elderly are vulnerable because they often have one or more of these pre-existing conditions. Anyone can get it. It is important to know that people can have the disease, not show any symptoms, i.e. fever, sore throat, cough, etc., and still take it home to spread it to their families. So please be safe.
What can we do to minimize the risk of getting COVID-19? Stay home. Put your health and the health of your family first. Wash your hands often and only go out for groceries and essential items once a week.
Do not share food, drinks, or smokes. Coronavirus transmits through drops in your saliva and also coughs and sneezes.
People should stop or at least limit smoking and vaping because coronavirus affects the lungs and smoking and vaping can cause serious health risks.
If you are an essential worker, thank you. Keep your personal items away from your work area. Wash your hands frequently. Avoid touching your face. Before entering your home, have a pair of flip-flops or house shoes by the door to change into. And set up a place to isolate any items that cannot be washed and that you don't want to bring indoors. Immediately remove your clothing and place them in a specially designed hamper or basket by the door. Use a garbage bag to line that hamper and wash the clothes immediately when you get inside using the warmest water temperature recommended on the clothing label. Wash or sanitize your hands one more time and wipe down your phone. Some healthcare professionals suggest showering immediately upon returning home as well to make sure no dangerous viruses are still on your body. Lastly, you might be asking yourself, what can I do to help? If our community comes together, we can make it through this pandemic.
Help your elders in your community. They are at greater risk. See if they need groceries or medication and pick them up during your weekly grocery run.
Oakland, family, we can get through this, but we're gonna have to stay safe.
Stay safe.
Stay safe and stick together. This does not have to continue. We are not invincible, but we are resilient. As our ancestors might say, we were built for this moment. Check out the links below for ways to apply for unemployment, to access free food, health tips, and other information about how the coronavirus is impacting the Black community. Stay healthy, stay safe, and stay Black. God bless you.